So our case is a right knee patellar tendinopathy, which is in the chronic phase. We have a 24-year-old male basketball power forward, which this player complains 7 out of 10 on the VASC during stair and negotiation, squatting, kneeling, jumping, and running and walking on ramps. So before doing our treatment, we are going to be assessing through ocular inspection, take the vital signs of the patient, palpation, sensory assessment, ROM of the lower X, MMT of the lower X, measured leg length discrepancies, balance testing, postural assessment, and gait analysis. Results are seen here on your screen. Patellar tendinitis is also known as the jumper's knee. It is caused by overuse of your knee joint, such as frequent jumping on hard surfaces. So, hence the name. So, the symptoms of it is pain and tenderness, swelling, and pain when doing such activities such as running, jumping, or walking. Our plan of care includes strengthening the knee extensors as well as doing functional activities for the patient to do squatting, kneeling, and jumping, as well as for the patient to do stair negotiation, running, and walking on ramps. So also the patient should elevate the knee. The patient will also place a orthesis as well as place ice packs for the swelling. So before doing every exercise, the patient must do stretching. First, introduce yourself, and then you could ask the patient if he is comfortable of using a knee support when performing the activities. If so, we could use some knee support. It is important to introduce yourself, introduce the patient to the pathophysiology of the condition that he is undergoing, and to teach him the rationality of each of the exercises that we are doing. Because our patient is an athlete and he's already in his chronic phase, we are going to be performing activities that could prepare him back into function and prepare him to play basketball again as a power forward. So why do we do strengthening exercises? Because weak muscles can contribute to the strain on the patellar tendon. Since we are treating an athlete, we can still continue with the treatment even there is a little bit of pain. But if the pain is no longer tolerable, we can stop it. So patellar tendinitis is a common overuse injury caused by repeated stress on the patellar tendon. So if the patient feels pain, the patient can also use NSAIDs. Most of our exercises are functional exercises, but for those exercises wherein you are using weights, we are just gonna be progressing it by adding weights or by adding reps. For the functional exercises, we could make the surfaces uneven or make the objects that they are holding heavier, as well as we could also add some resistance bands or resistance. Our three primary goals are also of the follows. The patient will be able to perform maximal to moderate difficulty performing squatting, kneeling, jumping as manifested by an increase of 20% in the KOOS scoring after 4 weeks of PT treatment, as well as the patient will be able to perform maximal to moderate difficulty performing stair negotiation, running, and walking on ramps as manifested by an increase of 20% in the KOOS scale. Also, the patient will be manifest an increased strength of the right knee extensors from 3 plus to 4/5 and So for the home exercise program, the patient can just be creative at home and do these exercises that we are teaching during the PT rehab. So it is also important for the patient to elevate the joint so that the swelling could be addressed. So rapport is very important here because we are treating an athlete, and for us to treat the athlete well, we must gain their trust. Also, in our treatments, we are not just going to be treating the ankle, specifically the right ankle. We're also going to be treating the muscles surrounding, such as the hip muscles and the ankle muscles, because the lower X acts as a group. Also, for the home exercise program, we could add that the patient should do cardiopulmonary endurance training so that he could have a good overall health. So the patient is young, has an active lifestyle, is not a smoker, does not have diabetes mellitus or asthma, does not drink alcoholic beverages, is ambulatory without assistive devices. So our prognosis is good.